Hi, my name is Rosalind Belt. Actually, it's Dr. Rosalind Belt. And I want to share some information with you about dental insurance. And I'm going to tell you why. Let me tell you my story first. About almost 2 years ago, I had a infection, or I had a tooth that was killing me, and I didn't have any dental insurance. So I had to go to a dental school, the emergency section. Well, first of all, I had to get up early in the morning. The dental place, it was a dental school, and had to get up early in the morning. It opened at 8 a.m. You had to be there at 6 a.m. to get in line just to get through the doors, because they were only going to take the first 10 people. So I did just that. I had gotten that information from somebody else who had already done that. Got in there, and they started, this was a junior student working in my mouth, pulling out the tooth that was needed to come out, they said. And in the middle of him pulling that tooth out, all of a sudden I heard this thing go crack, and that was my tooth cracking. And of course he had to go and get his instructor to help him, and they dug a trench. These are their words. They dug a trench to get that tooth out. After that moment, I said, never again. I will never go through that again. So I began to do my research to find out about dental insurance. And here's what I want to share with you in this video, that all dental plans are not equal. There's some things you need to look into before you get dental insurance. And the reason I'm sharing it even more so is because with the Affordable Care Act being passed, a lot of people are assuming that dental is a part of the Affordable Care Act, and it's not. So you need to know, because you're still going to need it, and so many things go wrong in our mouth with our gums and fillings and etc. And it can go from bad to worse. There are people that have died because of a tooth infection because they couldn't afford dental insurance. But all dental plans are not equal. You've got to look at what you're paying out of pocket for the major work. You can find a plan everywhere that will let you go to the doctor for hardly any money and pay $5 for your teeth cleanings and get fillings for real cheap. You can find those. But when it comes to those crowns and those root canals and the dentures and braces for the kids as well as the adults, that's where you want to focus your attention to find out what you're going to have to pay. When they just give you that percentage, you need to know exactly what you're going to pay. Secondly, are you going to be limited about how many cleanings you're going to have? Most plans have a limit, but you need to know what they are. Does it limit how many you're going to have for you and change that limit for your children, or is that limit just to your whole family, no matter how many members in your family? Thirdly, do you have to wait before you get major work done? There are some plans out there that I found out through my research that once you get the plan and it's active, you still have to wait before you can get major work done. And I know when you need to get a crown done, when you need a root canal done, you're going to need it when you get it. You need it when that plan is active. Fourthly, are there any age limits? See, you want a plan that can go with you no matter how old you are or no matter how young you are. If you're over 65, if you want it to be useful, till you die. Fifth, is there an annual maximum that limits coverage once you've reached it? I kind of covered that a little bit already, because a lot of times when you reach that annual maximum, then you've got to pay full price. Say that maximum limit is $5,000 and you've reached it. You can reach that so quickly. Even $10,000 these days you can reach so quickly. You don't want to have to pay full price at that point. Then you've got to know, are there any time limits? Do you have to do certain things by a certain length of time? Can you use it any time of the year? You don't want any of those restrictions on you. And then 7, are there enough dentists in your area? You've got some plans that you're so restricted to the network that you can't find a dentist in your area that will accept the plan. And you always want to make sure that there's some dentists in your area that accept the plan, even if it's not the dentist that you're accustomed to going to. Sometimes you have to change dentists to get a better rate if that dentist won't accept it. But you do want a dentist that's close to you, close to your work, your job, or close to your house, or whatever's convenient for you. And then lastly, is the price going to change? There are some plans out there that after I found out that the price doesn't change. In other plans, they go up just like your cell phone goes up, just like your house note goes up, just like, all the things in our lives usually go up. But there are some plans, if you'll research, that the price does not change. Because I was able to find plans that had no deductible, 5 cleanings per year, no waiting period, no age limit, excuse me, no annual limit. If you get it by the 15th of the month, you can use it on the 1st of the month. I found plans that you can have dental providers where you can find them anywhere and the price never changes. Well, I hope that you've taken notes. I hope that you've grasped this, and as you begin to do your research and as you begin to look, remember, all dental plans are not equal. I hope that we've covered everything to help you understand, because again, as I said, in the healthcare reform, dental is not included in the necessary mandated plans that all of us are going to have. So be encouraged and be successful in finding a great dental plan. Have a great day. This is Rosalind Belt signing out.